Good evening, doctors. Welcome again. Today we are going to discuss about systemic sclerosis. This is a part of rheumatology, and systemic sclerosis means the crash syndrome. All symptoms are present. So please, those who are still not watching my lecture crash syndrome about, so please go through and watch the crash syndrome lecture, then start watching this systemic sclerosis. Let's brief we are going to discuss about crest. Crest means C means calcinosis, R means Raynaud's phenomena, E means esophageal dysmotility, S means scleroderma, and T means or sclerodactyly. T means telangiectasia. Syndrome means symptoms. Plus, this is not limited to peripheral extremities, often affects the face and neck. Okay. And also, some constitutional symptoms include palpitations, shortness of breath, fatigue, and weakness. We diagnose systemic sclerosis by clinical basis and by the support of labs. And the treatment here, firstly, we have to prevent the renal crisis like malignant hypertension, need to prevent and decrease the pulmonary hypertension. Okay, now, how to treatment if a skin thickening, we need to use here D-penicillamine. Okay, and for the Raynaud's attack, we need to treat with calcium channel blocker, that is nifedipine. And for scleroderma and renal crisis, we have to treat with AC inhibitors, that is lesinopril for renal crisis, AC inhibitor. For Raynaud's attack, that is CCB, calcium channel blocker, and for skin thickening is D-penicillamine, and for GI symptoms PPI like omeprazole. The symptoms are related like a Barrett's esophagus. So guys, thank you, good day and goodbye. I hope you like this video. If you like this video, put like on it. If you have any queries, any question, you can ask me, and if you still not subscribe my channel, please subscribe it. Thank you, good day and goodbye.